teenagers as well as adults, and typically progress through 4 stages: the prodrome, the aura, the actual attack itself, and the postdrome. Not everyone who has a migraine headache goes through all stages or actually realizes they're going through all the stages. The prodrome can occur 1 to 2 days before a migraine, and somebody might notice a subtle change that warns of the upcoming migraine, including constipation, mood changes from depression to euphoria, food cravings, neck stiffness, increased urination, fluid retention, and frequent yawning. For some people, the aura might occur before or during the migraines. The auras are reversible symptoms of the nervous system. That means it's not permanent damage, but the nervous system will rebalance at some point. They're usually visual, but they can include other disturbances. Symptoms usually begin gradually and build up over several minutes, and usually typically last for about 60 minutes. Examples of auras include visual phenomena, such as seeing various shapes, blind spots, flashes of light, loss of vision or tunnel vision, pins and needles sensation in the arm and leg, which can be quite disturbing, weakness or numbness in the face or one side of the body, and difficulty is speaking. So it's no wonder that people who are having the beginning of a severe migraine may think that they're having a stroke, as well as the personnel in the emergency department. Migraine headaches can last from 4 to 72 hours if untreated. How often a migraine headache occurs varies from person to person. Migraines may occur rarely or strike several times a month. During the migraine attack, the pain is usually on one side of the head, but can be on both sides. The pain is a throbbing or a pulsing sensation. There's high sensitivity to light and sound, and sometimes smell and touch. Most people will retreat to a dark room, pull the covers over their head, and just pray for relief. Nausea and vomiting. Nausea can occur, and vomiting generally provides relief. And the fact that vomiting provides relief is a clue to the actual cause of the migraine headache, which I'm going to cover shortly. After the migraine headache, what's called the postdrome, after the migraine attack, the person might feel drained, confused, and washed out for up to 24 hours. Some people report feeling elated. Sudden head movements might bring the pain back again briefly. Migraine headaches are a curse. Migraine headaches have been recognized as a curse for thousands of years. 3,000-year-old records from ancient Egyptians describe these painful headaches. And around 400 BC, the Greek physician Hippocrates described the visual disturbances that can precede the migraine, such as flashing light or blurred vision. He also described relief felt after vomiting, which again is our clue to the cause of the migraine headaches. In the 2nd century, the Roman physician Claudius Galenus coined the word migraine from the Roman words meaning half of the head. Galenus also pointed to the connection between migraine headaches and the stomach due to the associated nausea and vomiting. Again, the nausea and vomiting is a constant recurrent theme in the migraine headache. It is the holistic physician root in to the solution. Migraine headache treatments have ranged from applying hot irons to injecting garlic, from bloodletting to witchcraft. Sometimes I feel like I'm doing witchcraft when the person has migraine headaches. In the 1930s, the first workable migraine drug treatments were introduced. While drugs may have a blunt effectiveness, they are not a perfect solution because they do not address root causes. And if you have migraine headache patients, you will know that they're also not a perfect solution because they may not fully resolve the current symptom. They do nothing to restore the balance of the body, and in fact, further upset the balance of the body. And they offer no hope for a cure. So I'm not opposed to patients using these medications if they help them, but it's with the realization and the cognition that this is not a cure, it's a Band-Aid. You have a bleeding wound, you have to stop the bleeding before you begin the healing. So I've now brought to you the most important slide of this webinar. And if you tune out, which I hope you don't for the rest of the webinar, please remember this one, because this is the holistic professional's view at the source and the ultimate resolution for migraine headaches. So the Prodrome starts with from the bottom of the screen with the digestive disturbances. The stomach is then innervated by the vagus nerve, which is the longest cranial nerve in the body, starting from the brain and giving sympathetic nervous system support for the upper digestive tract. So the signals for the digestive disturbance fly up the vagus nerve and hit the brain. The brain now wants to absorb the shock of these heavy signals, so it diffuses the electrical impulse to other cells of the brain. This diffusion affects the blood vessels in the brain, causing the muscular wall of the arteries to contract. Vasoconstriction leads to less blood flow to the brain, which is the source of the aura. The source of the prodrome is just the normal digestive disturbances that people might feel if they've eaten the wrong food. And if you go back to that slide, you'll see the prodrome is all digestive disturbances. But when it hits the brain, the migraine begins in earnest with vasoconstriction. So now those blood vessels, they're holding on tight, and they're going to hold on for anywhere from 1 hour to maybe several hours. But the vessels around, the circular vessels around the arteries are not designed for sustained contraction. They fatigue and pop open. When they pop open, blood rushes into the brain, overloading the brain, and you get the symptoms of the migraine attack. The migraine attack lasts for as long as it does. The body is now struggling to restore vascular control up in the brain area. When it finally does, the patient enters the prodrome phase, which is adrenal exhaustion. Their body is exhausted, just they're like they were out there running the Boston Marathon. They were running a neurological marathon, and they're fully exhausted. Recovery is needed, and that might take a day or two. I recommend that patients do not, if they're in the postdrome, I recommend they take it easy for 24 hours. Let them recover, let them sleep, take the day off, take some time off, just lick their wounds and recover. If they force themselves to go back to work and do high activity for some unknown testosterone, androgen reason that they have to get back and prove themselves to the person they always were, they're not going to help themselves, and they may set the stage for even worse migraine headaches. So just encourage them to relax, let their body begin the magic of rebalancing. But now we slide in, we have our wedge to handle the migraine headache, and next week we're going to use this wedge to prevent or limit the migraine headaches from happening in the beginning. But if they're already mid-migraine headache, prevention is out of the question, treatment is needed, and that's what we're going to see now. And so the next most important slides are the handout that I have for you, and this is the handout which gives them basically the standard process protocol and the video that you're going to watch, teaching them, excuse me, the acupuncture points. This is the next page, because these are acupuncture points. The acupuncturists, my acupuncture friends, have already taught me that instead of using inches to measure from a body landmark, they use, the smart Chinese use what they call the proportional inch, or the human inch, which is the width of one thumb at the knuckle, called the soon. So if we wanted to say we had Ben Viola and he had a migraine headache, and we were going to do the point that was 5 inches up from the navel, well, 5 inches up from his navel, I guarantee you, will be greatly different anatomical location than 5 inches up from the navel of, a 2-year-old child. And so we use the smart Chinese proportional inch, and it's 5 1 thumb width for the child, or 5 1 thumb width for Ben. And of course, it's not your thumb, it's his thumb. So this explains it to the patient. And here are the 3 points that we're going to teach the patients to use. Yin Tang, and they can have this handout, so it's a quick guide. They don't have to watch the video while they're having the headache. Here's kidney 27, and there's a description here, and a large intestine 20 in the description here. The next page is the standard process protocol, and I'm going to go over the background and the planning for this, why we're using these supplements in just a couple of minutes. And then over here is the course disclaimer. So the first magical supplement from standard process is Phosphate Liquid, which is typically used for digestive issues, 10 drops upon arising in water upon arising before meals. Make sure you tell them to take this with water. Sometimes they put it on their tongue, and boy, I'll tell you, that's a mistake. Phosphate Liquid encourages healthy blood calcium phosphorus ratio, promotes healthy cellular metabolism, supports bone health, contains phosphoric acid, which is the dissolved phosphorus, inositol, and riboflavin. Phosphate Liquid, great for hypothyroidism, joint stiffness, arthritis, gout, kidney stones, and of course, migraine headaches. Next product is Minchex. Dose is 3 twice a day, supports the nervous system. It's a moderate calmative to help maintain emotional balance, eases the effect of temporary stress, and it has bovine auric cytosol extract as well as other things in there. Minchex is great for hyperirritability, insomnia, hyperactivity, tachycardia, heavy metals, and of course, migraine headaches. Neuroplex is the next fabulous product. Twice a day on an empty stomach. This supports the nervous system, supports cognitive function, contains a broad spectrum of vitamin minerals and complementary tissues, the standard process animal tissues to support endocrine organ function. Neuroplex is great for endocrine support, brain support, hot flashes, PMS, and for appetite control. AC carbamide 3 twice a day promotes the healthy formation and excretion of urine, promotes healthy fluid levels, supports healthy urinary system function, promotes healthy cellular fluid levels, and it's high in antioxidants. Great for edema, excess swelling, nightmares, glaucoma, kidney bladder function, of course, migraine headaches. I use this all the time for patients who have nightmares, and it is a big help. I had one patient just last week with night terrors, and we took them down with this magic little product. Also consider, so that was the basic protocol. Also consider LivCo twice a day. This is for detoxification, supports healthy liver function, antioxidant, maintains cellular health, supports digestive function, and contains schisandra, rosemary, and milk thistle. Great for headaches, allergies, skin problems, food intolerance, constipation. So you can hit more than one thing with one stone. Antronex 3 twice a day. Antronex contains yakatron, liver fat extract discovered by French researchers way back when Dr. Roy Lee was building these products. And he was so enthusiastic with it. And when he tested it, he was so excited about it that he decided that he wanted to make his own, and he eventually made his own, and that's why we have it today. Great for allergies, nasal congestion, hypothyroid, and portal hypertension. So what is portal hypertension? Well, I'm glad you asked. So the portal vein is all veins drain into the heart except for the digestive tract veins. They travel into the liver, and they call it the portal vein because it pours into the liver before going to the heart. The reason it goes to the liver before the heart is because it contains all the toxins and junks that may be absorbed through the intestine, and the body says, I don't want to pump that through the heart and the rest of the body. So it goes through the liver, which acts as a big filter, filters all the stuff out, and then passes it along to the heart. So why do you get high blood pressure in the portal vein? When the liver is clogged up with junk, and so Antronex clears the liver, opens, reduces portal vein hypertension, and then lets things flow well. So this is great on a lot of things. Okay, adrenal complex. Mediurb, twice a day, restores adrenal function, supports adrenal gland health, helps the body adapt to the challenges of daily life, contains the adaptogenic herbs, licorice and Normania, contraindicated in high blood pressure, and a few other things. Okay, great for type A personalities, multitasker, competitive, goal-oriented, very organized and patient, probably most of the people on this webinar. As a matter of fact, if you identify yourself as a type A, would you just throw that in the chat box? You can join me. Okay, Cataplex G, 3 twice a day, provides a calmative effect on the nervous system, encourages healthy parasympathetic nerve function. That is the vagus nerve. That's the trouble area. Supports healthy liver function, supports central nervous system function. So it's supporting the vagus nerve, plus it's supporting the brain during the migraine attack. Provides coenzymes and cofactors for cellular function, and trains a variety of factors. Cataplex G, great for vasoconstriction, great for high blood pressure, nerve regeneration, angina pectoris, vitamin B deficiency, including those that causes mental disturbances, and great for pregnancy. Not causing a pregnancy, although you might feel more frisky once you're taking vitamin B, but it's great for maintaining and forwarding the pregnancy because it provides better maternal blood flow. Chlorophyll complex, 2 every 2 hours. Chew, hold on the tongue for 1 minute and swallow. Chlorophyll supports many body systems. Chlorophyll is the biological basis for 99.9% of all life forms. If you think about it, there is radiation from the sun and there is inorganic minerals. It's the plants that join them together to make organic molecules. The plant has solar panels, leaves, and they collect the sun's rays, and the sun rays strike the chlorophyll. At the same time, the plant has a pumping system, and they're pumping inorganic minerals up from the ground, from the roots into the leaves, where the chlorophyll does its magic to make organic compounds, which is the basis for 99.9% of all biological life on Earth, except a few fungus. Chlorophyll complex, great for loss of blood, pre and post-operative, GI tract ulcers, stomach pain, vegetarian, multivitamin. So this brings us through the standard process protocol, and I'm now going to bring you to, I'm going to switch you to my screen for the video.
Hello. In the next few minutes, I'm going to show you how to reduce the length and severity of a migraine attack. Migraine headaches have been a curse for thousands of years. 3,000-year-old records from ancient Egyptians describe these painful headaches. And around the year 400 BC, the Greek physician Hippocrates described the visual disturbances that can precede a migraine headache, such as flashing lights or blurred vision. He also described the relief felt after vomiting. And in the 2nd century, the Roman physician Claudius Galenus coined the word migraine from the Roman words meaning half of the head. Galenus also pointed to the connection between migraine headaches and the stomach due to the associated nausea and vomiting. Shifts in hormones and neurotransmitters are also believed to contribute to migraine headaches in susceptible persons. Treatments have ranged from applying hot irons to injecting garlic, from bloodletting to witchcraft. In the 1930s, the first workable drug treatments were introduced. While drugs may have a blunt effectiveness, they are not a perfect solution because they do not address root causes or restore balance to the body. In Asia, acupuncture combined with herbal therapy has been used successfully for hundreds of years to reduce the duration and severity of migraine headaches. It is believed that acupuncture reduces migraine headaches by restoring balance to the body. A review of 20 high-quality trials involving over 4,000 participants found consistent evidence that acupuncture is beneficial in the treatment of acute migraine headaches. In the next few minutes, I will show you how to locate and activate acupuncture points for migraine headache relief. My name is Dr. Baritz. I'm a chiropractor, nutritionist, herbalist, and I'm certified in acupoint physical medicine. I've helped thousands of people live better naturally, and I want to help you too. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos come out. The first point for migraine relief is gallbladder 14. Gallbladder 14 is known as Yang White. Yang for strength and white for peace. Yang White literally means peace through strength. In addition to helping reduce migraine headaches, Yang White has been used to clear vision, reduce eye pain, and eye twitching. Yang White is a popular point for cosmetic treatments because it is said to lift the eyelids and improve circulation to the eyes. Yang White is found the width of your thumb above the center of your left eyebrow. About over here. Activate this point by rubbing it quickly 5 times, then take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. Now find and activate Yang White on your right side. Conception vessel 12 is the next point that has been shown to help reduce the severity and duration of migraine headaches. Conception vessel 12 is known as middle cavity, signifying its effect on the abdominal organs. In addition to helping with migraine headaches, conception vessel 12 is said to help relieve stomach pains, acid reflux, symptoms associated with gallstones, and to help normalize cholesterol levels. Interestingly, conception vessel 12 is also used to relieve hiccups. Conception vessel 12 is located 1 hand's breadth above the umbilicus. To locate this point, place the flat of your hand on your belly just above your belly button. Then using deep pressure, feel for a spot that is sensitive, sore, tender, or painful just above your hand. That is conception vessel 12. Activate conception vessel 12 by rubbing the area quickly 5 times, take a break for a count of 5, and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. During or shortly after stimulating conception vessel 12, you may notice a sensation of heat or energy in your abdomen or back. This is normal and therapeutic. The third point to help relieve migraine headaches is gallbladder 40. Gallbladder 40 is known as the mound of ruins, indicating its use for injured body parts. In addition to relieving migraine headaches, gallbladder 40 is said to reduce inflammation in the eyes and to help with foot and ankle rehabilitation. To locate gallbladder 40, put the tip of your index finger on your left ankle. Then move your finger to a point that is just below and just in front of your ankle bone. Press into this area to feel a little depression between the 2 bones. Now locate a point that is sensitive, sore, tender, or painful. That is gallbladder 40. Activate gallbladder 40 by rubbing it 5 times rapidly. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. Now locate gallbladder 40 at your right ankle and repeat. After stimulating gallbladder 40, move your toes, feet, and ankles around. Notice that they are moving more freely. I recommend 6 points for treating an active migraine headache. The 3 I covered with you in this video: gallbladder 14, yang white, conception vessel 12, middle cavity, and gallbladder 40, mound of ruins. Plus the 3 that I covered in my video, Prevention of Migraine Headaches: large intestine 20, the welcome fragrance point, yin tang, the hall of impressions, and kidney 27, the palace of transportation. These points can be used with or without medications. For migraine headache relief, it is suggested that you use these 6 points every waking hour till the migraine is past. I wish you a speedy recovery. Till next time, this is Dr. Baritz signing off, yours for health naturally.
That basically completes that video. Can I answer any questions about the acupuncture points or about the supplements? Is there a handout? Yes. Hopefully Ben has sent that to you, or Ben will send that handout to you. And then you can get a copy of the PDF of the presentation. That'll be available tomorrow. Let's see here. Have clients with migraine headaches. Yeah, hypertension medication. People on hypertension medication often require migraine support. I myself was bowling tournament years ago, 7 strikes, end of the tournament. Never happened again. Can you intervene with acupuncture at any stage of the migraine headaches? Yes, you can do them at any time. And so you actually can repeat those points really every 20 or 30 minutes. The only problem with repeating them too long, say you're going to do them like every minute or just keep doing them constantly, is the point can become basically exhausted, and it'll cease to function for about a day or so. But if you have a migraine headache, every 30 minutes isn't a problem. Let's see here. Does AC carbamide dosage until what dosage you use? For the night terrors, I just used exactly what I put on the screen. You could double the dose if you want, or but that's really about it. It's a great product. Frequency of self-acupuncture for clients. Typically, I recommend no more than 3 times a day. So they might do it in the morning, they might do it once in the afternoon, or sort of once as needed, and then once again in the evening. Again, if they're doing them, if they're like an anxious person and they're doing them just too much, they're going to exhaust it. It's a biological system, and they're just going to exhaust that point. It'll cease to, they won't hurt themselves, but they'll just exhaust the point, and it won't work for about 24 hours. Can you use a cold laser? Absolutely. So as we covered in the first seminar, acupuncture is a procedure, is a philosophical approach to health and disease, and does not spawn many techniques. The needle, of course, is fabulous. The laser, the cold laser, microcurrent, using your finger, using the tation, using a tuning fork, these are all excellent options. And there is some, professional debate as to which is the best treatment, but that's really insignificant to the fact that they all work. And what is the third acupuncture point the doctor asked? I'm going to just refer you back to the handout, and then if you have a problem, then that should be fine. Can you use the cold laser? Yes, absolutely. And then do you show them? Yes. No, you don't have to do them in the sequence I prescribed, but I do prescribe them in a sequence starting from the easiest for the patient to maybe the more difficult one. starting from the less intrusive, maybe to the more intrusive. So I'll be more likely to do something on the hand and the foot than to do yin tang on the face. So I typically like to work from the outside of the body in towards the center.